Hello, I am Dr. Ramesh Patankar, Senior Consultant Neurologist at L Raheja Hospital and Fortis Group of Hospitals, Mumbai. Today we will be talking about epilepsy and seizures. In vernacular, it is also called as mirgi or akdi. Epilepsy is a chronic brain disorder, whereas a single episode of abnormal brain function is called as seizure. Seizures can be motor, where there is a movement of the arm or the leg, or it can be sensory, where there can be abnormal sensations. Sometimes there can be loss of consciousness. When more than two seizures, which are unprovoked in nature, they take place, we call it as a epilepsy. Epilepsy is defined as abnormal excessive electrical discharge of the neurons or the brain cells which result into abnormal brain functioning. Epilepsy is a treatable disorder. Prevalence of epilepsy in the world is 1 to 2 per thousand. In our country, because of infections and traumas and injuries, the prevalence is as high as 4 to 10 per thousand patients. There are many misconceptions and myths about epilepsy. People believe that epilepsy is a disorder, it's not a disorder, but it is possession of the body by the soul or the ghost. It is absolutely incorrect. This is a misconception, and if treated in time, epilepsy becomes perfectly all right. It is a curable and treatable disorder. There is also stigma in people's mind. They feel that if you reveal the diagnosis of epilepsy, there can be problem with the social life, there can be problem with the marriage, there can be problem with the job. Hence, there is a stigma in the mind. But let me tell you, there are many personalities in the world who have done best in their fields. I'll give you an example. If you know Alexander the Great or Julius Caesar, these were the kings who won almost half of the world. They had Caesars. There is a wonderful footballer called Ronaldo from Brazil. He won Golden Boot in World Cup. He also had Caesars. Jonty Rhodes from South Africa, who's a great cricketer and wonderful fielder, also has Caesars. There are many great authors who do had Caesars and still their books were very popular. Namely Agatha Christie, Charles Dickens, and Dostoevsky from Russia. So you can achieve everything in your life even if you are epileptic. Now let us see the causes of epilepsy. There are many causes of epilepsy: hemorrhages, strokes, infections of the brain like tuberculosis or neurocystic sarcosis, that is a worm in the brain, or meningitis, encephalitis, head injury, head trauma can result into seizures. Some people, there can be a genetic background and their progenies can have seizures. But there are causes of seizures which are non-genetic. Now let us see what are the different types of epilepsies. Epilepsies are classified into partial and generalized epilepsies. Partial epilepsies, they are further divided into motor, sensory, autonomic, and complex partial. Motor partial seizures is a jerky movement of one limb or one side of the body which may go into progression, which is called as Jacksonian march of seizures, which speak of partial motor epilepsy. Sensory seizure is characterized by abnormal sensation lasting for some time in the leg or hand. Complex partial seizures, there are some wonderful phenomena which are mentioned. Deja vu phenomenon. Deja vu phenomenon is a French word which means sense of familiarity in unfamiliar surrounding. Patient goes to some place which he has never seen in his life and he feels that he was part of that. This is deja vu phenomenon, which was nicely picturized in old Hindi movie called Madhumati. There is another phenomenon called Jameau phenomenon. Jameau phenomenon speaks of unfamiliarity in familiar surrounding. Say for at your working place, you go and suddenly you feel that, well, I do not understand where I am. I am unfamiliar to this place. This unfamiliarity in a familiar surrounding also is called as Jameau phenomenon. Sometimes there can be micropsia or macropsia. The objects or surrounding people, they seem to be very small or giant. These are the Lilliputians and giants of Gulliver Safari. So such type of things can also happen with complex partial seizures. Now let us discuss generalized epilepsy. There are three types which we will be discussing, which are commonest. First is generalized tonic-clonic seizure. There is a phenomenon called aura. Aura is a feeling that patient gets before he gets the attack of a seizure. So he tells, there is abnormal feeling in my stomach, abnormal smell, as if some rubber is being burnt. He's irritable, he cannot concentrate, there are mood swings, there can be headache, there can be twitching of the face. This is aura. If you recognize aura, you can stop the further seizure by some good medicines or nasal sprays called midazolam spray. If allowed to progress further, these patients, they can have clenching of the teeth, saliva coming out or frothing coming out. There can be a tongue bite and blood coming out of face. Then they fall down. While they fall down, because of the spasm of the throat muscles, there is abnormal sound which is generated, which is called as epileptic cry. The sound is like this. They fall down. Once they fall down, there is a tightness of the limbs, which is called as tonic phase, which progresses into clonic phase or jerky movements. These are violent jerky movements of the upper limb as well as lower limb. Few of the patients, they can have incontinence of urine and feces, that is involuntary passing urine or feces in the clothes while they are having seizure. Then they remain unconscious for 5 to 10 minutes, and after that period is over, they regain consciousness. Following seizure, there can be a period where they may be confused. There may be post-ictal headache or vomiting. This is how generalized headache usually proceeds. Many times, what happens? Generalized tonic-clonic seizure, there is no recovery in between. If that happens, then it is called as status epilepticus. It is medical emergency, and one has to admit them in the hospital or even in ICU. Sometimes it can be life threatening. So one has to be careful about it. Now we go to the second type of epilepsy called as juvenile myoclonic epilepsy. This is epilepsy predominantly seen in young girls around puberty. The commonest presentation is sudden jerky movements like this. Especially they happen when you get up in the morning. When you get jerky movements or myoclonus, the objects from the hand, they fall down, like toothbrush flings from hand, coffee mug falls down. Many times, rather than realizing that these are seizures, parents call them inattentive, careless. But if treated in time, this juvenile myoclonic epilepsy can completely be treated. A specific EEG associate called uh, can diagnose juvenile myoclonic epilepsy in time. They need long-term treatment for control of epilepsy. Now, the third type, which we'll discuss, which is common in children, is called as absence seizure. It is also called as petit mal seizure. In petit mal seizure, usually it happens in children. It is short lasting. There is a blinking of eyelids, smacking movements of the lips. They blink, they smack, and they are inattentive. There is a transient loss of consciousness. These attacks can be as high as 50 to 100 times in a day or even more. Many times parents do not realize because they are not eye to eye or face to face. But teachers in the school, they can pick it up. So education of the teachers for detecting petit mal is very important. Petit mal seizure, if treated in time, can again get well with the drugs like valparin sodium or ethosuximide. There are a few other interesting epilepsies we'll just go through. They are called as reflex epilepsies. One of the epilepsy is called as eating epilepsy. Nothing happens all throughout the day, but when child or a person with the epilepsy sits for eating food, during eating with one or two things in mouth, he starts getting seizures, and they lose weight. These kind of patients they respond very well to medicines. There is something called as a reading epilepsy. While reading certain paras, certain patterns, patients can have epilepsy. Musicogenic epilepsy is also well known epilepsy, where a piece of music can trigger seizures. There was one movie called as Curse, where a piece of music was played, and then the patient goes into last birth, or he feels that he's in last birth. Such kind of phenomenon can happen with musicogenic epilepsy. Important mention about another disorder called as hot water epilepsy is essential. This is common practice in South India, where children are given bath called as oil bath, where oil and hot boiling water is poured over their head. This leads to kindling of the head and results into seizures. This can simply be avoided by training of the parents that don't pour water. If at all you want to use lukewarm water and don't pour directly on the head, but just put your hand in between. So hot water epilepsy can be avoided. Another common epilepsy in children, which is a benign form, is called as febrile seizures. Febrile seizure is a genetic form of epilepsy. It runs in the families. Whenever there is high grade fever between the age of 6 months to 5 years, these patients can have fits or seizures. The simple little thing one can do is that give them antipyretic or the medicines which will reduce the temperature, give them tepid sponging, and their seizures are under control. Many a times, these patients without fever get seizure, and if that happens, that means it is a complex febrile seizure and they need anti-epileptic drugs. Now coming to a diagnosis of epilepsy. Can we confirm our epilepsy? Yes. There is a mode called as EEG or electroencephalogram. Electroencephalogram is a recording of electrical activity of the brain. Electrodes are pressed on the brain around the head and abnormalities are detected. So this is like ECG. EEG can confirm the diagnosis of epilepsy. It can also tell you about the type of epilepsy and it helps your doctor to decide what medicines can be selected for treating epilepsy. For looking for the structural lesion, CT scan or MRI scan of the brain is also done, which can pick up subdural hematomas, stroke, tumors, certain abnormalities right from the beginning, neuronal migration disorder. So MRI is a very useful tool. For those patients who require surgery, certain metabolic studies are done with PET and SPECT scan. There are few activities epileptic persons should avoid. One is driving and another is swimming. If you can do that, you can avoid catastrophes. Now question comes, in case a common man sees a person having seizure, what he should do? First, support the person so that he doesn't fall and injure. Second thing, turn him on one side so that all the secretions, blood or froth comes from his mouth directly by gravity and he doesn't choke up in his secretions. Loosen his clothes for better aeration and then call for immediate medical help. Patient should Patient with epilepsy should consult their neurologist who will help them to confirm the diagnosis, decide the type of epilepsy, and select appropriate medicines. Statistics says that 70% epileptic patients become perfectly all right by the end of 3 years if they take medicine regularly. 10% people they require medicine 5 to 7 years, and 10% are called as refractory epilepsy. They do not respond to medicines. There comes special situations, especially in the young girls who are using contraceptives. There can be contraceptive failures with certain anti-epileptic drugs. So you should consult your gynecologist and neurologist if you're using these drugs. During pregnancy, again a question comes. International League Against Epilepsy recommends two drugs very specifically, lamotrigine and levetiracetam, which are safe in pregnancy, which can so person can plan pregnancy, continue pregnancy without any hazard. Another important advice is during pregnancy, all of a sudden, always plan a pregnancy and all of a sudden, don't stop your medicines. Now, about refractory epilepsy and surgery. Those patients who continue to have refractory epilepsy and their lives get disturbed, currently surgical treatment is available for epilepsy surgery. Here, abnormal electric discharge generating tissue from the brain is removed and patient get a great relief. So it is important to know about epilepsy in general. Now take home message for all of you. Epilepsy is not ghost, not possession. It is a treatable medical disorder. 70% people, if they take medicine regularly, in 3 years they become perfectly all right. And for refractory epilepsy, surgical options are available. Thank you.